So I think we're all good to go. So welcome to today's live video AMA. It's the 9th edition in our live series on YouTube. We started hosting this monthly session in March of this year. And I'm very happy to be joined today by our CEO, Adil Esbay, and our Chief Medical Officer, Arno Bisschop. Similar to all of the previous sessions, we will start off with a number of pre-submitted questions coming from the Triall community. And afterwards, we will also reserve some time to answer any live questions that may come in. So starting off with the first question, how does Triall tackle protocol limitations or inefficient advertising models on the side of sponsors and complex study protocols, lack of awareness and distrust around clinical trials on the side of subjects? So I hope you got that question, Adil. So the question relates both to the sponsor side and to the research subject side. Would you be happy to answer that one?
Sure, and thanks so much, Ray, for organizing this. All the previous AMAs we really enjoyed and learned a lot from. So we're looking forward to a very fun and also an informative one. So indeed, the answer you can split into from a sponsor perspective and a subject perspective. So this question seems to come from a knowledgeable person within the clinical research community. It's always nice that they also look at us, at what we do, appreciate what we do, but also send in questions. So from a sponsor perspective, I think what we try to do to tackle that is to offer a versatile platform that can be easily configured to any type of study phase or therapeutic area. We have several partners. One of them is a organization, a Dutch-based organization called Link to Trials, and they help us, for instance, in supporting sponsors with patient recruitment through various digital channels. So that is, I think, how we try to tackle or limit the, deviations from the protocol or deal with inefficient advertising models, because we agree they can be quite inefficient and thereby hampering the conduct of a study. From a subject perspective, we try to offer different patient-facing applications that are really designed with the patient in mind, and allows them to participate really from wherever they want to participate in a clinical trial. It can be from the comfort of their home, can be from wherever they are, as long as they are participating in a clinical trial, obviously according to a specific clinical trial schedule. The awareness of that really depends on the sponsor. We have different kinds of sponsors that value this importance differently. It's also tied to the therapeutic area. So if it's a very invasive or early stage clinical trial, then being connected and the information flow between the investigator and the patient obviously has a different dynamic than if it's a very well studied research area or very late in the life cycle development path. I think the aspect that was also mentioned is how we would deal with the distrust. And we think that blockchain is an important enabler here that can provide indisputable proof that data hasn't been falsified at a later point in time, or making sure that the initial research objective that was set out, that we actually follow them also during the clinical trial, and also that we report on them accordingly afterwards.
Thank you so much, Adil. I think that was a well-rounded answer. Jumping to the next question, and I'm going to hand this one over to you, Arno. When it comes to our health, we tend to look for information from experts in the field. Think of physicians, scientists, nurses, since it's essentially our life that is at stake. However, in crypto, anyone can do anything they like. So how has Triall brought blockchain to the rigorous world of medical care?
Well, thanks, Ray. That's a very good question to start with, and I think we talk about this a lot. I think that we should really differentiate between crypto and blockchain, because that's something that mingles every time we speak about it. And I think that crypto is something else than blockchain. And I think that blockchain is merely the technology that we're trying to look into at Triall. Another thing is that when we look at our team, we have people with a lot of industry knowledge, we have clinicians, we have people who really know their ways within data, patient data, healthcare, but also health care institutions. So we are well aware of the thoughts on blockchain and crypto, especially when it comes to data safety in this space. So I think on the other hand, when you look at the current situation in healthcare, then from my perspective as a medical doctor, I think that we should really challenge the status quo to solve problems. So we can't do just more of what we did before. We need to really improve technology or invent new technology to move forward, because the current situation in healthcare is really putting a lot of stress on a lot of people and systems, eventually harming the patients. So I think that we should move forward, and I think that one way to do so could be blockchain, and that is, to round it up, that is really something else than crypto. So we would like to really focus within Triall on blockchain technology and not crypto per se. And I think that blockchain could be one of the types of technologies that can help us solving very urgent issues within healthcare all around the world.
Yeah, thank you so much. And I think, we can really view crypto as just a subset of blockchain, where we not only have this tokenized component with the Triall token, but where we also leverage blockchain for verifiable data proofs, where we're looking to leverage blockchain for self-sovereign identity, and eventually leverage blockchain to open up the possibility for data monetization, as we have previously already talked about during these sessions. So there's certainly then many different angles and aspects of this technology, which we are, of course, all very excited about. And it's all about bringing part of that excitement to the industry, while also being real about what are some of the actual benefits and what are some of the problems that blockchain might not be able to solve. So
all the things you just mentioned, they all add to solving these problems. So I think that's very important from a blockchain perspective within our, obviously with our token in the future and now already, but they all add to a solution to this urgent problem.
Yes, exactly. Talking about blockchain, so I will answer this next question. And it goes as follows. Blockchain could be a great catalyst for clinical trials, but what are trials planned to manage some setbacks that could be caused by blockchain's original features rather than operational faults? Well, examples that are mentioned are inadequate public-private key management, scalability constraints, plus loss of privacy caused by the transparency of the distributed system of the blockchain. I think that's a very valid and very good question. So thank you so much for the person that submitted that question. I think if we look at the blockchain industry as a whole, or perhaps I could also use the word Web3, we see that this infrastructure is getting more advanced and sophisticated by the years. I would even argue by the months. If you, for instance, would take the example of self-custodial wallets, you see that this whole infrastructure of being able to manage your own crypto tokens is getting more easy to use, it's getting more secure, and it's also getting more interoperable and interconnected. And we strongly believe that that's a good thing, because it is these type of developments that will benefit, well, not only the Web3 infrastructure, but blockchain adoption as a whole. Another prominent example is perhaps the migration of Ethereum, which migrated from proof of work to proof of stake, which was a successful migration, and it led to a sharp decrease in the energy consumption of the Ethereum protocol. And again, this all promotes and supports blockchain adoption on a wider scale. If we then, for instance, would take a look at self-sovereign identity, we see a lot of standardization being done in the SSI space. And this is all standardization that is based on security, privacy, and interoperability by design principles. So if we really look at all of these different developments, we see that a lot of engineers and other interested parties are really working on making this an infrastructure that is future-proof and that people can actually use across their business processes. Oh, then in sort of talking about privacy a little bit more, and again, this is something that we have covered in previous AMAs as well, is that this is mostly about the underlying process. So what is the type of data that you are actually going to store on a immutable and public blockchain ledger? And our mantra is really to never store original data, which is often personal identifiable information or other type of sensitive confidential information in our case, to never store that data on a public blockchain, but instead use the process called hashing, which creates like a digital fingerprint of a clinical trial data set or data object or document for that matter. And these can actually be safely stored on a blockchain ledger. So those are, yeah, I hope that provides a bit more context as to how we approach the problem of privacy and how we see all of these different developments within the Web3 and the blockchain space. Jumping to the next question. How does Triall intend to create an open and inclusive ecosystem for Web3 and develop programs and partnerships that will benefit the project and Triall token holders in the long run? Adil, would you be happy to answer that one?
Yes, of course, Ray. So I think one of the ways we're trying to establish this is really build upon new standards, Web3 standards. So there are several groups in the world that are building towards Web3 standards, and we're, being very aware of what they're doing and making sure that we build our ecosystem based on those principles and also that technological infrastructure. So we are not building the Web3 infrastructure ourselves. I just want to make that clear. We're innovating on top of that. And what we're basically trying to do is really bring the whole idea of that patients are coming first and patient centricity and patient engagement, really bring it to its core by enabling the patient community through the use of blockchain, but also other tools and approaches to really take ownership of the data that they generate. Why do we do that? Because we really feel that the patient should come first. Anytime you talk about development of medicine, it is ultimately for the benefit of society and also real life patients, like our family, brothers, sisters, you name it. So it becomes a very personal story almost. The way we want to create this inclusive ecosystem is through making sure that we provide access to those who need all these kind of innovations and inventions. And these can be, academic research hospitals that have a good idea and want to stay in touch or increase the diversity of their patient pools. And it can also be pharma companies, right, that want access to the right patients, to incorporate them or to help them through their own clinical trial. And what we try to do is we try to bring all these stakeholders together based on a platform that is built on Web3. And one of the ways that what we are building actually are also bringing together are ways to remotely manage the grouping of patients and to remotely increase how we engage with patients, but also create new pathways where data ownership really means something for the individual who is participating in a clinical trial. So through being able to really provide granular access to data that you generate if you're a patient, but also to create a digital way to stay informed on how your data is being used, and also create a digital way to be, for that data to be monetized. All with the idea to increase the options and to increase the ownership of that person that is generating the data as part of the clinical research context. We also, building and bringing together all kinds of other so-called e-clinical tools. So like e-consent, like e-pro, which is electronic patient-reported outcomes. So these are basically questionnaires that you can fill out. But I think also in our latest edition, which is a video conferencing tool within our ecosystem, it really adds a lot of value if the investigator and the patient can still also see each other, even if they are, working together on this clinical trial remotely. At the end of the day, we also believe that having face-to-face time between an investigator and a patient will always be very important for several reasons. But we know that facilitating research, and using the latest digitalization strategies, but also looking at the costs and the timelines that we currently still have to deal with when we run a clinical trial, we all try to bring them together in this ecosystem and thereby, provide ultimately equitable access to everybody who needs it. I hope that that sums up my response.
I think it did. Thank you, Adil. So I have another question for Arno, as it relates to the hospital setting. Will Triall venture further into hospital data management, given that there were so many ransomware attacks on them? So perhaps, Arno, you can talk a bit more about how we view electronic health record data, its relevancy for clinical trials, and perhaps some of the integration options that we are currently also providing.
Yeah, thanks, Ray. I think that's a great question. To start with, I think that an electronic health record is something that is really different from an electronic data capturing system. And it works actually like this. So if you have a patient coming into your office, then you take the health data from this patient and put it in an electronic health record. When this patient is also entering a study, then the data will also be entered into an electronic data capture system. And sometimes they work together. So sometimes the data is coming from the electronic health record into the electronic data capturing system. And you can see, obviously, that interoperability there is key. And that doesn't work the way it should all the time. So we are using an AI tool, an AI algorithm to improve that actually transfer from data. But to get back to the question, so an electronic health record is really a different company than what we do. So an electronic health record is about treating a patient, and what we do is about investigating patient data to get to a scientific article or to a drug on the market, etc. So I think that's two different things. On the other hand, obviously, we do have our thoughts on what an electronic health record should look like. I mean, if you would envision an ideal situation, then for me, it would be that I would carry my own health data and also my own sickness data. So there's always one interesting example is that a consultancy firm from the Netherlands, they investigated how many times a patient's blood type was investigated during the course of its life, and I think it was about 8 times or something. And trust me, this doesn't change over your life. So what you actually say is that there was drawn blood 7 times too many to get to the same to the same result. So I can see a situation in which you have your own data continuously on you, and you are not depending on the hospital where the data was captured at the first place. Because that's also another thing. And I mean, the Netherlands is not a big country, but what we see is that if you are going to a hospital, say in Amsterdam, and you are on a holiday in the east side of the country and you break your leg, the east side, Hadil, comes from that part. It's a very nice part of the Netherlands, for those who don't know. But if you break your leg there and you get into a hospital there, then there's no transfer of data or information between the hospitals because of privacy issues, etc. But I mean, that is really tough because you do have to do another MRI scan or another blood type investigation or whatever. So I mean, that's really a waste of efforts, of resources, etc. So that's, if you look at it from an electronic health record point of view, I would sincerely hope that one day you own your own data and you have it on you all the time, because then you can move to the electronic data capturing for clinical use, and you can, as we envision within Triall, you use your own data to help studies to move along and to progress and to go faster to their end result. So that's, I think it's a stepping stone. So hopefully, well, we do have a situation now at which we have these big companies who provide electronic health records, but hopefully one day the patient is its own electronic health record and can attribute to studies, whenever and however he or she like that.
And I think that's a very powerful concept, being able to carry your own data. That in turn also opens up a lot of different avenues across various verticals, including clinical trials and of course, including primary care. So I really hope that we will get there, preferably in the short run, but time will tell.
And actually, to add to that, Ray, I'm sorry, to add to that, what you already see it happening with health data, so not with sickness data, because health data is everywhere, right? So yeah, we all have our wearables, so you already see it happening there. But I mean, the next step is to do the same thing, but then for data on illness, on sickness.
Absolutely. Yeah, especially with all of these fitness tracking apps nowadays, there's a lot of data being generated. We could probably talk another 2 hours about this topic, but I think considering the time, we're going to jump to the next question, and I'll be happy to take this one. Considering the latest crypto events, with examples being Luna, Celsius, FTX, have you noticed any change of attitude of current or potential clients towards the blockchain and crypto space that could potentially impact adoption? Well, I think it's very important to underline that our customers really see Triall as a clinical trial software provider with an innovative blockchain and crypto side. So our customers' discussions are really mostly about the clinical platform that we offer, including its different features and capabilities, as well as our software compliance with industry requirements and relevant regulations. Well, this also makes kind of sense if you start thinking about what blockchain actually entails, which is it's a back-end technology that works in the back end, but most users of the software will not directly work with a blockchain ledger. Well, if we then jump and look at TRL, so the role of our token and how that's being perceived by potential and current customers, we really try to frame TRL within picture of bigger trends, such as the digitalization of assets, fractional ownership of data, and self-sovereign identity. And here we really explain how TRL serves as a key building block towards our clinical trial data exchange vision. Looking at some of these black swan events, such as happened with Luna and FTX, these certainly have had their impact on the crypto market as a whole. And I think we can also certainly agree that the stock market is not doing so well at the moment. I do think Triall as a company, that we are lucky to be part of healthcare, which is generally considered as an industry that is far more resistant to recessions, simply because everyone needs healthcare. And there's also a constant need for the introduction of novel medicine. So that's really an industry that tends to keep operating even in times of academic downturn. So that's just something that I wanted to add to that context as well.
Hey, Ray, maybe a brief addition from me as well. So I think the whole world has learned about FTX, and I think that we are far from fully understanding the ramifications it has. One of the things that you do see popping up now is really the ask for regulations around crypto-related activities. For us, regulations, they come natural with what we do because we operate in a highly regulated environment. So we are already aware and used to work within specific regulatory guidelines and requirements. I personally think that getting more guidance from regulators or other important stakeholders, whomever they may be, may benefit the whole crypto scene, to be quite honest, and thereby also, our own project. Because it means, levitating everybody to the next level in terms of credibility, in terms of also durability of projects and investability. This is something, especially in the current socio-economic situation we find the world in, is desperately something that, that we also as Triall would like to see happening.
Yeah, thank you so much, Adil. I think that's a great addition. And it really would help to make the crypto industry as a whole more mature and therefore also more sustainable. So I definitely echo what you say. And I think we as an entire company and our team are very much thinking in the same line of thought. So I'm going to jump to the last question of today. And if that's okay with you, I'm going to hand that one over to you, Adil. It seems there are quite a lot of companies in the clinical trial industry that are using old legacy software. How is the appetite to go through a change journey and onboard trial software? And is there anything Triall is doing to make this journey easier?
Well, that's a great question. I'm not sure if we've ever come across a company that likes change. So that would be my first part of the response. But there are ways to deal with change in a way that if you could see the benefit of it on a shorter term or on the longer term, then people tend to at least hear you out. And then also be part of the journey towards this new thing, this new vision, this new way of working. What we try to do is we always try to look at a few, I would say, change agent or like change behavioral components. Like, first of all, on the technical side, just be better in terms of a one-on-one comparison when it comes to features and capabilities. Also in terms of pricing, of course. We always try to understand the kind of systems the company use and not necessarily try to, replace them. So this is something I want to make very clear. Triall is not in the business of replacing legacy software. We're in the business of trying to either enhance existing infrastructure through APIs, that leverage blockchain as technology, or provide an alternative route to manage and operate your clinical trials. So these things can go hand in hand, really dependent on the company, how they're organized, and also on the programs at hand. So some programs are bound to legacy data that is decades and decades back. Also, those programs or companies we can still help through, for instance, our anchoring capabilities on the blockchain, right? So it's like a menu-like approach that we like to take. We understand, there is no one approach that fits all companies to transition to the new way of working. I think the pandemic again has been a huge, has taken down a few innovation barriers, because interoperability, the capability to work remotely, the fact that clinical trials are becoming more and more decentralized. This is not necessarily very innovative on itself, right? It's becoming more and more mainstream. But in order to do that successfully, you need to find the right partner. And we as Triall, we feel that we're acting as changers, or like being ahead of the curve through our service offering, and also try to prepare everybody to be effective when they manage and operate their clinical trials. What we also try to do is really understand who are the right stakeholders in the company and try to get them involved early. What I also would like to mention is that all these efforts also will hopefully have a direct effect on our token holder base. Because for us, it's also very important that we appreciate the trial community, but also getting more and more traction, getting more and more clinical trials on our ecosystem will help to increase the utility of the trial token. And that utility can be in peer-to-peer interactions, business-to-business interactions, etc., etc. But we also have this at mind, and I want our trial community to know, that in the way we are positioning Triall as a company, as a clinical research software SaaS company, we always also look at our trial token holders base and see how we can grow that in parallel. And at the end of the day, we find ourselves still in a very, I would say, convincing story that we tell as Triall. And a lot of these companies, although coming from legacy software, starting to understand that change is not, something that comes with a lot of adverse reactions or adverse events, but you can use that momentum as a force for good, to increase your own operating model, your own business model, and at the end of the day, make sure that you as a company are not lagging behind.
Thank you so much, Adil. I think that was a great answer, and I think it really touched upon a number of topics that we addressed during this AMA. Digital transformation is not always just doing things digitally. Sometimes it's introducing new ways of working. And I think that's really, one of the parts where whole tokenized aspect of Triall also will come in due time. I'd like to thank the both of you for joining me on this session as we now arrived at the end of our AMA. Similar to last time, so we will host a new AMA before the end of the year, probably the week before Christmas. So we'll make sure to announce the new AMA dates in a couple of weeks, and we hope to see you there on the final session for 2022.
Thank you so much, Ray, for hosting.
Thanks so much. Take care, everybody. Bye-bye.